everyone. Thank you so much for being here. We're thankful for UG Pines also being here as well. My name is Andrew Park. I'm the pastor of the Vassar Seventh-day Adventist Church, and I'm so excited for this webinar on natural remedies and hydrotherapy. And before we get started, why don't we bow our heads for a word of prayer before we go into today's webinar? Father in heaven, I'd like to thank you that you give us all that we need in your resources. And Father, as we learn more about how you can teach us to care for our bodies and use what's around us to also bring that same healing to others, I pray for your Holy Spirit to be with us now. I thank you for everyone who is present, and we want to give this time to you and ask for your blessing. In Jesus' name we pray.
Amen.
Thank you very much, Pastor. Thank you, Sister Sandia, for the invite. It's such a blessing to be with everyone. We're excited about what we have to share today. My name is Stephanie, and I'm the Lifestyle Educator Director here at UT Pines. I am originally from Jamaica. I've been here about 5.5 years. Nice to see you. And so it's a blessing to be here. Just a little bit about UT Pines. We're located in Seal, Alabama, and we're about 52 years old. We have various departments. One of them is the Lifestyle Center. And this is where we take people in for about 17 days, and they go through our lifestyle program for various diseases. We've seen cancer, diabetes, hypertension, and we've seen success with these things just using nature's wonderful remedies. We also have a beautiful farm. We have a health food store and vegan vegetarian restaurant located 30 minutes from here in Columbus, Georgia. And that's our ministry to the cities. We give Bible studies there, health classes, and we offer a wonderful lunch every day. We also have the store that has over 4,500 different items, and it's a very small place. So God is doing wonders there. Of course, we also have our education program here at UT Pines, and we offer the Lifestyle Educator program, which is about 6 months long. It is 6 months long. And we have the Lifestyle Counselor program, and that's 1 year long. And we have other programs as well, but those are our main two. And so it's very nice to be with you all. We know that the Lord has much to teach us, and so we know the blessing will be all ours, and we can share it from here on. We'll have the presenters introduce themselves when they come. We have 2 lifestyle counselors here with us. And of course, we also want to thank our brother Andre, who is the technician behind all of this, who is here with us as well. So now I'll just turn over to our first presenter.
All right, hello everyone. My name is Amelie Sandoval. I am, like Stephanie said, I'm a lifestyle counselor here, and I'm actually in the last couple weeks of my training at the end of the year. So I'm going to be starting off with the hydrotherapy presentation. So I'm just going to move off to the side here a little bit. You can see this. All right, so we're going to take a look at, can you guys hear me okay? Everything good? All right.
Yes.
We're going to start by taking a look at some of the rationale behind hydrotherapy treatments. So it increases the circulation of the blood. We know that perfect health depends on perfect circulation, right? So that's very important. It stimulates the immune system to combat disease, and it rids the body of toxins. These are probably 3 of the main uses or main reasons that we would do hydrotherapy. So some of the physiology behind how it increases the circulation of the blood. Right now we're looking at a cross-section of a blood vessel. And this is just a regular blood vessel. You see all the different layers with the blood in the middle. And when we apply heat to the skin, the blood vessels dilate. So this is called vasodilation. So you'll notice that they've gotten wider. Then when we apply cold, they will constrict. So you see that the area in the center for the blood is much smaller than it was before. So the change in the blood vessel size will increase the circulation. It has kind of a pumping motion. You're opening and closing, right? So this means that more oxygen and nutrients are brought to the affected area, and the removal of toxins and other waste products is sped up. So here's another graph. It's heat will draw blood to the surface, the hydrostatic effect, and the cold's primary action is driving blood away from the skin to the interior of the body, and its secondary action, once it's been applied for long enough, is bringing blood to the surface again. So we'll see how we use these different methods in hydrotherapy treatments with the hot and the cold. And since we don't have a lot of time and we want to be able to cover several treatments for you guys, we're going to go ahead and get right into it. Starting off with a hot half bath. We're going to start off with a hot half bath. So if you see here in front of me, we have a makeshift tub. They'll get the camera on that in a second. And this is just some chairs with a sheet over it. But I'm going to have Stephanie come join me here as my guinea pig for this treatment. And she's going to sit in this tub for me as I talk about why we would do this treatment. So some of the reasons we would use this treatment here would be sicknesses such as colds, flu, congestion. It's also really good for pain, muscle pain, especially pain in the pelvic area in the back. It's also good for a cough, poor circulation. Here in the Lifestyle Center, we use it mainly for cancer, lupus, diseases like that. It's also good for eczema, psoriasis, and it can also be used if your body has a fever to break the fever, right? And its strongest result is it stimulates the immune mechanism. And that's a lot of the reason why we want it, especially for cancer. Some reasons why you might want to be careful with this treatment or not give this treatment would be if the patient is very aged or they're young, extremely old. Both sides you want to be careful. And if they're frail or already cold, you don't want to do this treatment. Also seizures. Seizures can be triggered by different things, heat being one of them. So you'd want to be very careful with that. Chest pain as well, that can indicate heart issues, and we don't want to make things worse. This treatment will definitely increase your heart rate. So unless your heart is strong enough for that, you want to be careful. If you have severe shortness of breath, again, this is increasing your body's metabolic rate, so you will be breathing faster. So if you're already short of breath, it's probably not a good idea. And certain medications, you might want to consult with a doctor before you do something like this. So those are our little warnings for you. Now we're going to get into the treatment. So we have Stephanie here in the tub, and we'll have it as full as we can get it. A lot of your tubs at home, you can't really get it more than waist deep. So we like to use a bath towel and just spread it over the patient, come up around their neck like this. And then we will use, let me grab my pitcher here. We'll use a pitcher to just scoop the water and pour it up over them to keep their whole body warm. Now, when you fill the tub, you're going to want to fill it and have a pool thermometer, so you know, to about 104 degrees. Now, it depends on what the patient can tolerate. Some people, 101 is hot enough. Other people, they could get in at 110, 112, and they're fine, right? But 104 is a good place to start, and make sure they test it before they get in. You also want to make sure that they don't have, especially for diabetics, they don't have neuropathy they can feel, so that they know they're not burning, right? So she's in here, the water is 104 degrees. We have her towel up around her neck, and we're just constantly just taking water and pouring it to keep her warm. What we're going to do is, as soon as she gets in, we're going to check her oral temperature. All right, now we're not actually going to do it here. but you want to record their temperature about every 5 to 10 minutes. Usually 10 is good enough. Just keep an eye on them, make sure they look okay. So we'll check her temperature. It'll probably be anywhere from 97.5 to 98.6 maybe. Usually it's on the lower end. And you'll check it again in 10 minutes. And our goal is to get their temperature to 102 degrees Fahrenheit. Now that's a pretty good fever. A fever starts at 100.4, right? So we want it to be to 102. Depending on the patient, they may not tolerate it as well, that high. But you're just having them sit in this hot water to increase their temperature, right? So I checked her temperature, and now I'm going to check her pulse. So you just want to count their pulse and keep track of that at the same time as you're doing the temperature. So the temperature and the pulse every 10 minutes. You don't want their heartbeat to be going too fast, right? So usually for us here, if their heart rate is above about 130, we want to cool the heart. And so it's good to have an ice pack nearby. So if Stephanie's heart is going too fast, say her heart rate is 135 or something, I might take this and just place it over her heart and have her hold it there, and the cold will help just slow the heart down, right? Now, something that's very important, especially after the first 10 minutes of the treatment, is a basin of ice water. Now, of course, this is just dry, but have a couple washcloths, and when she starts to sweat, we're just going to be taking the cold water, just wring out the washcloth, and we'll just place it on her head, right? Now, you can leave one on the head. Some people like it when you dab their face with the cold. Other people, they want you to take it soaking wet and just pour it on their head, right? So let's say it's been another 10 minutes. We'll check your temperature again. And let's say, for instance, it's 101, all right? So she's already in a good fever, and we want her to have a fever for 20 minutes. So once she's to a fever, you want to start counting that 20 minutes time and give her water, not cold water, room temperature. Keep her hydrated. If you're not well hydrated during the treatment, you could end up having a headache afterwards, and you won't feel too good, right? And then keep cooling, of course. And as the warmer they get, the more you want to be cooling. So pretty much it's cooling constantly. Then you stop, take the temperature, take the pulse, and then cool again constantly, right? Now, once she's had her fever for 20 minutes, we're going to end the treatment. And I like to just take the towel off of them and put it to the side. And then in the shower or in your bathtub, just turn on the cold water. All right, so we'll pretend the faucet's on this end. I'll turn on the cold water once I've drained the tub most of the way, and I'll just fill my pitcher with cold water and just pour it over her, right? We've brought all the blood to the surface, and now we're driving it back in. If she gets up without doing the cold, she could pass out, and you won't feel as good after, right? So a lot of the benefit of the treatment prolongs the heat is when we drive that warm blood back into the center of the body. So you would just do this, pour it all over. She might not like the cold, but it's okay. Hold their hands down, do whatever you have to do. Get that cold all over, right? So we'll cool her off really good. And then give her a towel to dry off with. And the most important part is to wrap her well. Yes, and socks. So when she gets out of the treatment, you want her to put socks on. You don't want her to be cold, right? So we'll have her put on a nice warm pair of socks, and we'll take a sheet. And if you want to stand up for me, just take a flat sheet, wrap her up. Not too tight that she can't walk, but enough to keep her warm. And then we're going to take a blanket and wrap that around her as well. Are you hot yet? All right, so you see we have a nice burrito here. Stephanie is very warm, right? She just got out of this fever treatment. We did the cold. Now she's wrapped up. We'll take her to her bed and have her rest for 45 minutes to an hour after this treatment. Just lay down and rest. Make sure there's no fans blowing. The AC isn't blowing in her face. You don't want a cold draft, right? That's one of the most important parts of the treatment is the resting after. All right, so we'll unwrap her. So I already mentioned that it's great for colds and stuff like that. It's great for if you feel like you're getting sick to just do this treatment, and most of the time it will just knock it out. But I also mentioned that it's good for cancer. And one thing that it does, especially for cancer, is it helps the cancer cells identify themselves easier to the body, right? So it's increasing your immune system, but it also helps these proteins on the cell, the cancer cell heat shock proteins, identify the cell to the immune system. And so when it's exposed to this heat, those proteins display on the cell on the surface of the cell, the cancer cell. So your immune system that's being activated by this treatment can see it and say, oh, I need to get rid of this, right? So that's one specific way that is very good for helping with cancer. And for cancer, we recommend doing this 3 to 5 times a week. It's an intense treatment. You will be tired from doing it, but it's very, very beneficial. And we have people that reverse cancer with using this treatment. All right, we're going to move on to another one. I'm just going to leave one chair here because we're going to do a hot foot bath. Mm-hmm. All right, so we're just setting it up here real quick. So the hot foot bath, a lot of the same indications for it: colds, flu, congestion. Some specific things the hot foot bath is very good for is for headaches, for chest congestion, abdominal cramps, especially menstrual cramps is very good for, and pelvic congestion. And again, you want to be careful with diabetics, especially, or anyone who doesn't have good sensation in their extremities. All right, so I'm going to need Stephanie for this again. I'm just going to show you how I set up this chair. I have a chair with the blanket spread over it first, and then a sheet on top. And then we have just a plastic basin with hot water, same temperature as your fever bath water. So start with 104. We'll have her test it with her heel before she puts her foot in, and then we can increase the heat from there. All right, so go ahead and take a seat. Okay. So we're just gonna have you. All right, so just test the temperature of the water with your heel for me. Let me know if it's too hot.
Yeah, that's fine.
Okay. So you just have them put both feet in, move it to where it's comfortable for them, and then we're going to wrap the sheet around and get the sheet covering the bucket as well. Where's the other side of the sheet? All right, and then the blanket on top of the sheet. And notice we're really making sure that the patient is staying warm. Just keeping everything wrapped together. All right. Now this treatment, you're not doing so much checking. We'll give her water, make sure that she stays hydrated throughout this. But this treatment will pull the blood from, especially for a headache, it's congested in the head. It will pull the blood to the feet because that's where the heat is being applied. And it's really good for headaches. Also, same with menstrual cramps. You have a lot of congestion in the pelvic area. And so the water is pulling the blood down to the feet. Now, one thing we want to do is continuously check. And one of these electric kettles, if you have one, is very, very helpful. It's a super quick way to get hot water. And you just want to check and add hot water occasionally when it cools down. And you just want to put your hand between the patient's feet and where you're adding the hot water. So we'll have Stephanie move her feet to the side. We'll pour in some more hot water, just kind of swirl it around. And then, is that okay? Yes. All right. And then cover it back up again. All right. So you just want to make sure that the water is staying nice and hot for their feet. Now they will start to sweat. So again, we have a bucket of ice water to keep them cool while they're in the treatment. All right. And you want them to sit here for about 30 minutes. And at the end of the 30 minutes, you've kept them hydrated, you've kept the water hot for their feet, their headache is gone, or whatever it was for, menstrual cramps, they're feeling a lot better. Then we're going to lift their feet. Oh, yes. This is also very good for lowering blood pressure, especially if your blood pressure spikes really high. Do this treatment, it will lower it up to 30 points in 30 minutes. All right. So at the end of the treatment, we're just going to lift the patient's feet above the basin, and then we're going to take the cold water. We're going to take this cold water and pour it over their feet. And my recommendation is not to stand in front of them because some people have reflexes and kick when you put the ice water on their feet. So make sure you're off to the side. And then once your feet are cooled, you're going to take your washcloths with the ice water, just kind of wring it out. And then you're going to do some cold friction up their legs. So we're just going to do really quick towards the heart, just back and forth motion going up the legs. And that will be the end of your treatment. And obviously, we're going to put socks on, wrap them in the sheet and blanket, and put them to bed for half an hour to an hour after this. Now, one thing to note, if you're doing this for pain, especially menstrual cramps, you're not going to end with cold, all right? You just want to, once they're done with the 30 minutes of heat, wrap them up, keep them warm, and put them to bed. But for any other reason, we would be ending with the cold to their feet, all right? For the same reason, we want the blood to go back to the rest of the body.
What is the primary reason why this treatment would be given?
The main reason we give this treatment would be headaches, and probably here in the Lifestyle Center, high blood pressure, and occasionally menstrual cramps, but most of the time headaches and hypertension.
Thank you.
It is also good for sicknesses, but we do have other treatments that we tend to give instead of this one if you feel like you're getting sick, such as the one we just showed you, the fever bath. All right, let me unwrap you. You're sweating. Now, the facial contrast. All right, we're just going to pull this table forward. You can take the sheet off the end too. That's good. All right. So our next treatment that we're going to be covering is contrast baths. Now, this treatment is very, very versatile. As you can see there, it says facial, hands, arms, feet, and full body after it. And so we're going to touch on all of those things. We're going to be demonstrating the facial contrast, and that is especially good for sinus issues. If you have nasal congestion, sinusitis, hay fever from allergies and stuff like that, it's very helpful for. Once we show you how to do this, I'll come and you'll see better how to use it for other parts of the body. But we'll get started with this. We have two basins here. Once they get the camera on, we'll have two basins. All right, so you see we have these two basins set up here, and we're going to have one with hot water and one with cold water. Now, you want to have your pool thermometer handy again, and about the same temperature. Sometimes people don't like so much hot water in their face, so you might want to not start quite as hot for the temperature on the face. You can always heat it up as you go. And for the cold water, we're going to start with it just as cold as it will come out of the tap. No ice added at the beginning. And the next thing we're going to do is we're going to add in a couple tablespoons of salt to each basin of water. And this will just help with drawing the congestion out of your sinuses, all right? The salt is just, it's not necessary, but it adds to the treatment, all right? And the next thing that I find very helpful, not everybody uses this, but I definitely would not be able to do this treatment without it, is a snorkel. It doesn't have to be a fancy snorkel. These are, you can get them really cheap at Dollar General or something like that. But this is so that you can breathe while your face is in the water. And the next thing you're going to need is a towel for them to dry their face, a box of tissues, because we're doing this for congestion, right? So it's going to be clearing up and they're going to need to blow their nose. And then a towel just to wrap around their neck to help keep them dry, all right? Because your face is going to be dripping and you don't want it everywhere. So Stephanie, I have a, you go ahead and come, and a clothespin would have been smart. All right, so we're just going to bring this up around her neck, and I'm going to kind of just tuck it, maybe if it will be tucked into the back. A clothespin is also helpful. You can just pin it there. And we'll say this is the hot water. And here is your snorkel. Now, if somebody does not know how to use a snorkel, make sure they practice before they put their face in the water. It's just helpful if they know already. All right. So she's going to breathe through the snorkel and put her face in the water. And we try to have it so that the water is coming all the way around the edge of your face. It's hard to get it to your ears, but if you can, that's best. And she's going to stay in the hot water for 3 minutes. So we would have started our timer already for 3 minutes, and she's just here breathing through the snorkel in the hot water. Now, after 3 minutes, we'll go ahead and have her come up and then move over to the cold water. Now, she's going to be in the cold water for only 30 seconds. Now, while she's in the cold water, we're going to add a little bit more hot water to the hot basin, and then 30 seconds, you can come up and go back to the hot for another 3 minutes. Now, when she comes back to the hot, we're going to have a container of ice, and we'll add just a little bit of ice to the cold water and just kind of stir it in so that you make sure it's dissolved. Then 3 minutes in the hot, and then up, and then back over to the cold for 30 seconds. And back and forth. And you want to do that at least 5 times. You can do 5 to 7 times. And you can go ahead and come up. And you'll notice sometimes between coming up that she'll need to blow her nose. So you can always have a towel on hand for them to dry their face, have the tissues on hand and a trash can right next to them. And anytime they feel like they need to blow their nose in between, just blow their nose and then continue with whatever one was next. All right. That's 5 to 7 times. This is really, really good for congestion. Clears it up very quickly. And now we'll talk about some of the ways you can use this on other parts of the body. You'll notice on the slide that it's good for impaired circulation, inflammation, sprains, strains, and then it also mentions the sinusitis. So if, for instance, somebody had a sprained ankle or something, then we would use this treatment as well, but on the ankle. We'll see if we can get the camera on that in a second. So you could use this on your ankle or say your wrist. That's easier for me to demonstrate. You sprained your wrist for some reason. You can do 3 minutes in hot, 30 seconds in cold, back and forth. And it helps a lot for the pain. The swelling will go down a lot. And so it's really great for that as well. Now, my favorite contrast bath is a full body contrast bath. Now, unless you have 2 tubs next to each other in your house, that's kind of hard to do. But you can do what we call a contrast shower. And it's the same principle, except in your shower, take it as hot as you can stand it for 3 minutes. and then as cold as the tap will go for 30 seconds. Now, I know for you guys in Michigan, that's way colder than it is down here, but it's good for you. So 3 minutes, as hot as you can stand it, 30 seconds, as cold as the tap will get, and do that 5 to 7 times. This is my favorite treatment for when I feel like I'm getting sick. I've done this all the time. I feel a scratchy throat or something, and I will do this before I go to bed. And again, after this treatment, especially a full body treatment like this, you want to stay warm, wear socks, and go to bed for at least half an hour. An hour is better. All right. The contrast shower is super easy to do just in the evening when you're taking your shower before you go to bed, and just make sure you stay warm by resting, and it will knock the sickness out. When you wake up in the morning, you'll feel great. Some people also like to do this in the morning. It gives them a boost of energy for the day. And it's one of the best ways to reduce inflammation in your body and to boost your immune system for, especially we're going into flu season, and it's very important to know how to boost your immune system. So those are the treatments that we're demonstrating today. Does anyone have any questions about that? No? All right, we'll move on to the next portion where we're going to be doing some kitchen cabinet remedies.
We did have one question on this.
Okay.
For sprains, is there like a recovery time that, like, how much more efficient will the recovery time be when someone does the contrast, if there is even a time that could be given?
I think it's much faster, honestly. One of our lifestyle counselors, maybe a month or so ago, sprained her ankle pretty badly and couldn't really walk. And in a boot, she was wearing a medical boot, and she figured she wouldn't get better for at least a month or so from that ankle. But she started doing this twice a day, and within about a week, she was out of the boot. So it definitely speeds up the healing process of the body.
Thank you.
You're welcome.
I'm on? Okay. Can you hear me?
Yes, we can hear you.
So my name is Dixon Onsare, and I was born and raised in Kenya. And I came to Kansas to pursue a college education. And after finishing college in Kansas, I was touched by a very dear testimony. My friend who had kidney failure, he was due for dialysis. And his kidney doctor said he needed dialysis as soon as possible. And I was graduating nursing school at that time, and we called UT Pines. And after calling UT Pines, they told us to do a few simple things. They told us to exercise and to get on a plant-based diet, to drink water, to sleep on time, eat on time, things that were too simple for my mind at that time. But my friend implemented these simple laws of health, and in 3 weeks' time, he had another appointment with his kidney doctor, and his kidney doctor said that he did not need dialysis. And that really touched my heart. I applied to come to UT Pines, and that's how I ended up with Stephanie being my supervisor for the LE training. So today we will touch on kitchen cabinet remedies. So I will start with cabbage. Cabbage is one of the products or produce that many people have in their kitchen, and it's very, very essential in pain control. So we normally use the cabbage leaves, and there are different ways that you can use it for. Many people use it to detoxify or to stimulate If they are having, say, joint pain, because many people have arthritic joint pain, they can use cabbage to help relieve that pain. If they have burns, if they have insect bites, if they have boils, this cabbage can be very beneficial to them. Many people have varicose veins when their heart is not functioning well and their veins are not able to bring the blood back up to the heart. Just applying cabbage, I'll show you how to apply the cabbage, helps to stimulate the veins and to push the blood back to the heart. Shingles, eczema, gout. Gout is accumulation of purines or uric acid mostly to the great toe, and cabbage helps to detoxify the purine that has accumulated on that toe. So that's one benefit for the cabbage. If someone has ulcers, one of our best to go remedies for gastric ulcers is cabbage juice. So cabbage is beneficial both internally and externally for gastric ulcers and wounds and joint pain. So I will go ahead and show you how to use the cabbage. So if you could focus on the table. So right here, I have some cabbage leaves. It's very simple. You know, God's methods are simple. If they are complicated, they are not from the Lord. So I have cabbage here, some cabbage leaves. And say if someone has some pain, you just go to your kitchen, grab some cabbage leaves, don't throw them in the trash can, and just beat them up. If it's hard to beat them up, you can use a rolling pin. So you can use a rolling pin. You want the juice to come out. So just roll it. And once you see the juice start to coming out, then it's ready. See, you see the juice? Once you see the juice on the cabbage, you can put it on the joint and then wrap it with a saline wrap. So let's say Sister Stephanie has some pain in her joint right here. This is a little bit big. I will place it on the area that she is having some pain. Then I will wrap it with a saline wrap. And once you wrap it, you can have her keep it for like 2 hours or overnight, depending on how much time she has. And we have seen people's pain level go from 10 to like 2 or 3 in a matter of 2 or 3 hours. Mostly joint pain, inflammation, arthritic pain, that cabbage is excellent for pain. And next we will talk about the benefits of aloe. Aloe vera is another very basic plant that God has blessed us with. And aloe vera, we normally use it here a lot for burns. If people have burns, we use aloe vera for burns. Sunburns, if someone has sunburns. If someone got a cut from radiation, say they are undergoing chemotherapies and they have some burns from radiation. If someone has itching of the skin, if someone has inflammatory bowel disease, if they have an upset in their inner stomach lining, inner intestinal lining, aloe vera used internally helps to go and soothe the wounds inside. Crohn's disease, if they have inflammation of the colon, mostly the ascending colon and the ending part of the ileum, the small intestine, and the cecum. Cecum is also a portion close to the ascending colon. If they have inflamed intestines, then internal use of aloe vera helps to treat that. If they have heartburns, overproduction of hydrochloric acid, aloe helps to treat it. So mostly intestinal issues, if they have scalp or hair issues, aloe vera used externally helps with that issue. If they have stretch marks, a lot of people have stretch marks, aloe vera helps to treat that. If you have nausea or stomach pain, aloe vera helps with that. If you have infected gums, aloe vera used internally will help bring relief. So I'll simply demonstrate how to use aloe vera. So how I like using it is I like peeling off the edges. So these edges that are sharp, you can just peel them off. So just peel off these edges that are sharp. A peeler makes it a lot easier. And you want to keep the gel. The gel is what you want to use. So you basically peel. It's getting there. I think it's easier when I'm peeling towards myself. When I'm peeling towards myself, it's a lot easier. So once you have the gel, you just blend it with some water. There's no specific quantities that you need. You just freestyle it. Just freestyle the quantity of water. That's the benefit of the Lord's methods. They're simple. So this gel, just mix it with some water and blend it. And you can take it internally to help relieve any gastric issues. Here in the center, we do like 4 ounces. We use like 4 ounces of aloe vera before breakfast and before lunch if someone has gastric ulcers to help treat the GI tract internally. If they have cuts or burns, just do the same, and the gel, rub it on the area that has the open wound. So that's how we use aloe vera externally. And we will go to our next one. Our next kitchen cabinet. I have a picture here that demonstrates how aloe vera helps to treat the wounds. You can see the first week, the ulcer was very bad, but after a few weeks of using aloe vera, the wound completely became dry and pigmentation came back, indicating good blood flow. Perfect health requires perfect circulation. So next we'll be talking about charcoal. So charcoal, we use it a lot here, especially if someone has infections, if they have nausea, vomiting, diarrhea. We use charcoal to help them have formed stool. If they have bad breath, they can use charcoal as well. It helps to remove the bad breath and also slow down tooth decay. It helps to whiten teeth. You can buy toothpaste that has charcoal. It also helps with drug overdose. They use this in the emergency room as well. Inflammation, charcoal is excellent for inflammation. I will show you how to do that. Insect stings, snake and spider bites, high cholesterol. If someone has high cholesterol levels, they can use a tablespoon of charcoal in water daily, and that will be very good to help lower cholesterol numbers. But you want to use charcoal, you want to space it 3 hours before or after taking medications. Liver detox, I'll show you how to put a poultice for charcoal to help with liver detox. Like I said, the dosage that we use here is, you can use a tablespoon of charcoal in 8 ounces of water, mix it and drink it, or 4 capsules to 8 tablets of charcoal, and that is activated charcoal to help with the internal benefits that you want to get from it. Food tends to interfere with absorption by 50% reduction when stomach is full, so you just want to space it out. And like I say, the main way or main reason that we use charcoal here in the center is people who have high cholesterol levels. I have seen cholesterol numbers go down from 298 to like 140 or 150 in just a matter of 15 days or 10 days by consistently taking a tablespoon of charcoal in 8 ounces of water. And when you take a tablespoon of charcoal in water, you want to increase your water intake, because charcoal also, as much as it helps prevent diarrhea, it could cause constipation. So you want to increase your water intake to prevent constipation. So I will basically demonstrate how to do a charcoal poultice. So here with me, I have a chalk spud. You can buy this online. The reason why we like using this specific brand is because it has a layer that we can put the charcoal paste. I'll call it a charcoal paste. You'll see why. We smear it in here, then we seal it and place it on the area that needs attention, that needs healing. So charcoal by itself is not a very easy product to deal with. So we need flax seeds or castor oil to help bring it or bind it to a paste-like consistency. So this is the consistency that we want. So what I did is I put some flax seeds and some water and some castor oil, any brand of castor oil. We are not very, the Lord is not very complicated. So any brand of castor oil that you can get, or you can use it with flax seeds as well, and some water. Then just mix it up nicely to this consistency, and like cake batter, like good vegan cake batter. Once you have this consistency, then just smear it on your chalk spud. I'll show you how. We use this if people have goiter. I had one patient who had goiter, and the goiter was really swollen, and we made a poultice. This is what we call a poultice of charcoal, flax seeds, and some castor oil. And in 12 days, you could not see the goiter. So that's the beauty of charcoal. The Lord put some anti-inflammatory benefits in charcoal to help treat goiter. People who have surgical wounds, you don't want to put charcoal directly over a wound, but you can make a poultice and prevent the direct contact of the wound with charcoal, because charcoal tends to scar the wound. Charcoal tends to scar the wound, so you want to prevent or avoid direct contact of charcoal with the wound. And that's why we make this poultice. If all you have is water and charcoal, you can go ahead and use it and just mix it up until you have the paste consistency. And if you don't have this chalk spud, you can use a paper towel or a cloth. Just smear the paste in between the charcoal towel or the cloth. This is how you want it to be. And place it on if someone has diabetes and we want to stimulate the liver is right here. So at night, you put it on the liver, and then you wrap it with a saline wrap. So you put it on the liver, wrap it with a saline wrap. That is if someone has liver issues. If their liver is inflamed, if they have fatty liver disease, if they want to do a liver detox, charcoal is excellent for a liver detox. If they have appendicitis, that is inflamed appendix, then we can do the same. Just place the charcoal poultice over the appendix, and it's going to help decrease that inflammation. If they have diabetes and we want to stimulate the pancreas, put the charcoal poultice over the pancreas area, and it's going to help bring relief. Goiter, like we said, place it on the thyroid, it's going to help bring relief. If someone has eye issues as well, if their eye is inflamed at night, you can just make a small poultice, put it on their eye, put a masking tape on top of it, let them sleep with it, and in the morning, they should get some relief. So those are a few ways that we use charcoal here in the center, and I pray that you will experiment on these things and the Lord will give you more wisdom on how to use it. So next, we will make nature's penicillin. This is like a natural antibiotic. A natural antibiotic. We use it for colds, for flus, for sore throats, infections, COVID, respiratory problems like pneumonia. If people have pneumonia, we use it for that purpose as well. We use it to strengthen the immune system. So people who have compromised immune system, if they have AIDS, HIV, AIDS, if they are on steroid medications and their immune system is suppressed, then we use this nature's penicillin. The ingredient is very simple. We use one grapefruit. We use one grapefruit. We use one orange. We use 2 lemons, 3 cloves of garlic. You can use more garlic if you want to. We also use half of a large onion. You can use a whole onion if you don't mind the taste of onion, because onion is rich in quercetin, and quercetin is excellent for boosting the immune system. 3 drops of peppermint oil. Peppermint oil is excellent to help soothe the GI system as well. And what we will do is we will basically cut these fruits and onions in pieces and place them in a blender with enough water so that it can blend well. Then we will blend it, and you can either, we will add the peppermint oil at the end of the blend. So I'm going to go ahead and demonstrate how to make this Russian penicillin. So I'll glove up. So like we said, cut the fruits. So I have my grapefruit here. And like you notice, the grapefruit, the way we peeled it, we left the pectin still active. We didn't peel it all the way because the whitish thing on the grapefruit has pectin, and pectin is a very, very good source of fiber. It helps with detox. So we want to save as much nutritional components from our fruits as possible. So I'll basically just cut this. I'll cut this and put them in my blender. You know, the one thing I love about the Lord is He's very simple. I don't have to be very, very specific on how I cut these grapefruits. I think this is too large though. So just cut your fruits, your oranges. You can use, if especially you are giving it to a child and he cannot tolerate the strong taste of the grapefruit, you can use some pineapple as well, and it's more tolerable to the child. Or you can use, you know, instead of using 2 lemons, you can use 1, because the main goal is to have the child benefit from these fruits that have the healing elements in them. We have a Vitamix blender, which we really use a lot here in the center. And a blender will help make this Russian penicillin, will bring it to a good consistency. And once we get enough of the Russian penicillin, once we bring it to a blend, you can drink a cup of this nature's penicillin. And you don't have to drink all of it at once. You can drink a couple tablespoons throughout the day, but make sure that you drink the whole cup before the end of the day. I put some garlic in as well. And I will add some water. I will add some water to make it easier to blend. The peppermint we mentioned, we will add it at the end. I think it needs just a little bit more blending. So I will show you the consistency that we want. So this is the consistency that we want for this Russian penicillin. So we will have Sister Stephanie. Sister Stephanie have a blessing. She will have a taste of this Russian penicillin, especially after receiving a fever bath.
Remember the peppermint.
Oh yes, the peppermint. The peppermint, we just want 3 drops. So just 3 drops. There we go. Peppermint, if someone has respiratory issues, you can just smear peppermint on their chest, and that inhalation of the peppermint will be excellent. That's good. And then we'll also have our last demonstration for the day. We are going to do an onion syrup. This is a simple remedy that I have used. So this is how much we yielded. We yielded this much from that recipe. So you can refrigerate the rest and continue using it over a couple of days. So for the onion syrup, we'll need 1 medium onion. We need some honey. We need to have a mason jar or a container. We also need a knife and a cutting board. And onion, like we mentioned, is high in quercetin. And quercetin is excellent for using it as to help fight bacteria or infections. So one simple method to make this onion syrup is we're going to cut the onions into a ring shape. So I have the onion, I'll just cut them. I'll cut them in rings and put them in a mason jar. Especially for children, if children have infections, this is a very, very good way for them to get the benefit of onions, because we are going to put some honey, so it's not going to be as bitter. They can tolerate the honey. So we will add honey to cover the onions, then we will let it sit for 3 to 4 hours. And after that, you will drain it. You will drain it and you can put it in the refrigerator. And after putting it in the refrigerator, you can use a tablespoon or 2 tablespoons, a tablespoon every 4 to 5 hours. So just cover it with honey. Cover it with honey and let it sit for 3 to 4 hours. You will notice that a syrup will form. That should be good. A syrup will form. We use this in the center a lot, in the lifestyle center a lot, when people have COVID or pneumonia or flus. It's very beneficial. So very simple. If someone has asthma, they can use this as well. And that will be the end of my presentation. And just, we always need to pray before taking any of these remedies, before doing the hot foot bath, before doing a fever bath, before doing a facial contrast, before using the aloe, before using the onion syrup, before using the charcoal, we always need to pray. And we also need to reform when we realize that we made some decisions that were not so beneficial to our health. We need to adjust our practice and cooperate with our Heavenly Father and His divine agencies to bring health and reformation to our life. Exodus 23, verse 25, and ye shall serve the Lord your God, and He shall bless thy bread and thy water, and I will take sickness away from the midst of thee. So I will hand it over to Sister Stephanie, and she will close us out.
Thank you very much, Brother Dixon and Sister Amelie. Thank you very much. And I'm happy I was here to be a part of all of this and to taste that nature's penicillin. It's really good. When you get used to it, it's really good. So are there any questions that you have at this time? We are at the max of our time. It's a little after 4. But if you have 1 or 2 questions, we would love to take those at this time.
There was a question regarding the onion syrup and what you use onion syrup for before COVID, and how you knew that it could potentially benefit once COVID began.
Yeah, so as you know, onions are antiviral, so you do get that benefit from just the intake of the onions, but it's mainly for coughs. So it's very soothing and helps with coughs. That's mainly what we use it for. It's like a cough syrup.
Excellent. Any other
Anything
questions
else?
on this
Yes.
end? I think that is all the questions on this end, and we want to thank you and your excellent team for the comments here are that we have never seen cabbage used before, and it sounds like an excellent remedy. And so
It is.
thank you. And we can close out in a word of prayer.
Yes.
Ask our pastor to do that for us.
Just a quick question before we close. Do you have any
Yes.
handouts of maybe the major ones? Because it truly is so simple. And
Yes.
Waller and I, we were just kind of blown away at some of the things.
Yes. So UG Pines does produce this little booklet called Simple Home Remedies. And so if you call Country Life, so if you visit our website, you'll see this whole array of our departments. If you call Country Life, they can ship that to you. I think the cost is $7. I'm not sure if anyone here knows, but it outlines all these things, the treatments, as well as the natural remedies that we used here today. So it's a $7 booklet. And UG Pines will also be at GYC, so probably they will have those there as well.
Awesome. Wonderful to hear that.
Yes.
So I was thoroughly blessed, and
Yes.
during a lot of the presentation. So thank you for taking the time. Thank you.
Many blessings.
I can close out with a word of prayer.
Yes.
Thank you so much, Father, that your ways truly are simple and they are effective. I thank you for all that we've learned today, and I pray that you may teach us and even impress us on when we come into real life situations, how we can apply this into day-to-day life. Keep this in our memory, and also when it comes to the people around us, show us how we can be a greater blessing to those that we come in contact with. And we thank you for the time. Pray for your Holy Spirit to continue to be with us. Pray this all in Jesus' name. Amen.
Amen. Thanks again and many blessings.
Yes, thank you so much.
Yes.